and giving us the numbers, the latest numbers today. This address coming in a little bit earlier than the usual address where you would definitely get them at around 3 p.m. So let's cross over there and listen in to the same.
This is a council that is there for you, and these are people that we can use for that purpose. And therefore, I cannot emphasize enough our appreciation of the work that they have continued to do. But before I ask Eva Jenga to also say something and perhaps respond to one or two questions that you might have, because I will not be having any other press conference today. This is it for the day. So if you have a question, we will allow you to ask the question. But before I do that, I also wanted to say one or two things regarding the position in the country today regarding COVID-19. The first one I would like to talk about is in discussions again with the medical personnel and persons who are informed, we have realized that it is possible that the weather that we are experiencing at the moment is also part of the reason why we may be seeing our figures climbing up. Not so much because of the particular weather of the day, but because this is the second peak season of the flu. As you know, we have two seasons, one in March and May, and then we have got the second peak, which is July, September, and October. And of course, when you get flu, then that means that you have an underlying issue regarding your ability and your immunity to protect yourself from the disease. And therefore, it's just to urge people in this cold season, it is very important that we do a number of things. A is that we must avoid congregating together. That is the gatherings we have been talking about, and that informs you also. Part of the decision that we took to stop the sale of alcoholic beverages in restaurants and other places. It is part of that reason. It is to reduce the people congregating together. And you should avoid it. As a Kenyan, you should avoid it. And the second thing, of course, is to adhere to the infectious control measures that we have given to the country, and one not repeat the same thing over and over again. We have continued to try and upscale our testing. One of the reasons why we had slowed down a little bit is because the reagents that we got, the ones we have been getting from China, some of them by donation, some of them we are buying, what has been available has essentially been manual reagents. And when we have got the manual reagents, we cannot test as fast as we can with the automatic reagents. So that is why you see delays. So when and I want to apologize to Kenyans, when you hear that your sample was taken, it has taken you 2 days, it is not the intention. The intention is to give them with as few hours as possible. But when we have got manual reagents, then we have got a challenge as to how many we can actually be able to test per day. But hopefully, this situation is improved. It will improve. It has already started improving, and that is why for the day, we tested in the last 24 hours, we tested some 5,259 persons, therefore bringing a cumulative figure of 289,759. Now, out of those 5,259, some 544 persons stand positive, and out of them 340 are male and 204 are female. So we need to again, this gender issue, if we were getting just a number of male that we get for females, the figure would be substantially low. But I also want to point out to our female folk and our sisters and mothers, your figures are also now beginning to go up. So I hope it doesn't mean that you are also beginning to misbehave. And you know, as these figures begin to come up, we hear all sorts of rumors about China, about the effects of becoming positive. We hear very strange rumors, which I'm not going to participate in perpetuating, because I don't want to be a rumor monger. But the men should be careful. Men should be careful with this positivity that we are continuing to get, particularly young men. You should be very, very careful with the infections and possible side effects that in future, we don't know, but in future, we don't know what side effects some of these diseases will have. Let's be careful. We also lost 12 people in the last 24 hours in various hospitals around the country, which now brings the total to some 311 persons who have also passed on, and our sincere condolences to the families of those who have lost their loved ones. We have discharged some 113 persons, bringing our cumulative discharge a total of 8,021. And this is the work of our case management people, the doctors, the nurses, who are managing our people in such a manner that we can continue to increase substantially the number of persons we are discharging from our hospitals. That means that we are still retaining a fatality rate of about 1.6% as opposed to the current global one of about 4%. So kwa hivyo hakuna kuongeza mambo mengi. Kawaida ni kusema ya kwamba watu wale ambao wanazidi kuhitaji ile vitu ambao tumekataza, ni lazima mjaribu sana. I know sometimes it's a challenge. Wengine walikuwa wamezoea sana hii mambo ya pombe, lakini sasa wewe useme asante kwa Mungu kwa sababu amelete hii mambo ambayo itakuzuia wewe kwenda huko kwa bar kunywa pombe, na ile pesa ulikuwa natumia na hiyo pombe sasa unaweza kutumia kununulia watoto kitu kama guo, unaweza kupatia mama kidogo na yeye apate ka viatu nice. Kwa hivyo hiyo pesa ulikuwa natumia na hiyo mambo, wewe tumia na kitu mzuri. Wewe sasa angalia nyumba yako, uangalie uone ni kitu gani unaweza fanya. Wengine mama alikuwa anafanya kelele ya kitu fulani anataka, wewe mpatie, mnunulie hiyo kitu. Hata mimi nitafanya vile vile. Hata mimi nilikuwa nafurahia Kagwe Special. Kwa hivyo hiyo pesa nilikuwa na hiyo maneno, hata mimi nitasaidia pahali, ama nimpe mtu mwingine nyumbani, ama nisaidie kununulia mtu mask ambaye alikuwa hana mask. Tukifanya mambo kama hayo tutakuwa na saidiana sana, na itakuwa jambo la maana na jambo mzuri. Kwa hivyo Wakenya, tafadhalini, hii mambo tuishukue kama ilivyo, tujue ya kwamba this is a dangerous time, but we must also live. We must also stay alive. And to stay alive, we need to be positive. We need to assist each other. The way the doctors act for us, the way they give themselves to us, the way they participate in saving our lives is a way that we should try and emulate in saving each other. We save each other. You save me, I save you. You protect me, I protect you. So at this point, I would like to, before question time, I would like to give Dr. Eva Jenga a chance to say something regarding the institution, and particularly to tell you in the media, perhaps a little bit about the challenges they have had and the successes, because Kenyans are too happy. I want to warn you, Dr. Jenga, to just say positive things, because the minute you start criticizing yourself, you are going to give fodder to people who are very, very ready to say that you have done absolutely nothing over the last 6 months. But I'm not talking about these members of the press. Members of the press in Kenya have been extremely positive and extremely helpful. And we want to thank you as well for the work that you have continued to do. The only thing I would urge is that when it comes to the interviews, bring in people who know what they are talking about. Thank you. Dr. Jenga, please.
I'll keep my mask on also. Thank you, CS. We do appreciate the good words you have said about the council, and I know the council members really feel appreciated. And even as much as we know we are in this battle, all of us, because we are patriotic and we are working for the Kenyans, which is always nice when our bosses also know that and appreciate us. So thank you again. So I think it will be nice to highlight what does the council, as a regulator, what it is. And I'll say this in a very summarized way, because there's a lot of things. We are here to regulate health, the quality of health that is in the institutions, the facilities. We license the facilities, and before we license them, we inspect them. We also have the mandate to actually decide on the quality of the doctors that we train. So through the people who qualify to come and do medicine, this council has a mandate to give the criteria at the minimum grades that somebody going to do medicine. And even as you do medicine, we come and monitor the universities, the medical schools that you are training. There are some guidelines as to what a medical school must achieve to be able to be recognized. We are also governed by the East African Joint Inspection Regulators, which was approved by all the ministers of health in the region, whereby there is an agreed minimum qualifications and standards for medical schools and even students, so that we have what it's called, we recognize each other across the region, so that we have reciprocal registration. So someone training here and qualifying here does not have to go and sit exams in Uganda or Tanzania. They can go across the boundaries and actually get a job. The same thing, people coming from our partners can come and practice here. And they present their papers to the various regulators. They are examined through the committees, and if you satisfy the committee that you have the criteria to qualify, you are allowed to practice. This way, we are able to regulate and to avoid and to catch up with quacks, because I won't call them doctors, they are quacks who try to pose as doctors. So that one, we are now very much alert, and we've been able to bring people and get them whenever anybody tries to come and register. Because all we need to do is pick a phone, get on the computer, and get to our partners in Tanzania and find out, are you sure this person qualified there? And what is important also, through the East African region, we are putting all our members on our website. Everybody, we have indexed our medical students, so everybody is online. So it's easy. If a member of the Fourth Estate calls me and asks me, is this person licensed? All I need is the name and the year they qualified. And my IT people will just get online and they'll tell me, we don't have such a person. And I'll call you back and tell you, that's a quack, it's not a doctor. So it is easy now. And we are able to do that because we've developed our IT system. It's very strong. It's not 100%, but we are getting there. 80% developed. We still need to get it to a point whereby we can make sure anybody, you can click on our website and be able to check. You can go to a facility and check whether it is actually licensed by the council. By looking at that's every facility, even my clinic, I display my license from the council. So if you go to a facility and they don't have the license from the council, then you should question yourself and find out, am I going to a safe place? So these are the things as a council to protect our people that we are doing. We are going further to improve the IT system so that we in the country will be able to improve telemedicine. And this will be able to be licensed. It will get the registration and gazettement from the Ministry of Health, so that since we don't have enough specialists for the whole country, we can have a specialist, maybe a critical care specialist or a radiologist, looking at an X-ray here that will inform somebody, a patient diagnosis in Kajiado or in Madera. This is going to happen in a very, very near future. It is already happening in some counties, but we want to make it national. So in essence, that is exactly what this council is been doing. But quickly, can I tell you what we've been doing in the last few months in COVID? This council has been involved from the word go. When the Ministry of Health and the government said all the flights must be quarantined, all the travelers coming in, it is this council that put everything together. We worked very hard, and that is how the numbers of the numbers you are seeing today are not in the thousands. Because initially we had almost every COVID that came in was a traveler. But of course, because of sometimes some of the things, this virus, the way the virus behaves, we could not avoid the local transmission. And this is where now we are at. How can we slow down the local transmission? You have heard a lot that we are going to get a peak maybe in August, September. And that is where everybody in globally, they have to get to a peak. But we are not just sitting back here waiting. So what we are doing at the moment, we are going to mobilize to have more quarantine centers with the support of the Ministry of Health, with what the President announced the other day. Our CS now has the power to get any institution, any government facility, and upgrade it to a quarantine and even to an isolation center. Why are we saying this? At the same time, we are saying you can quarantine at home. There are people in the informal sector, much as they may want, if they know they have someone in the house who is positive, there is no way they will have proper quarantine or isolation. And these are the people we now, as in the government sector, we must save them and get them into safer places. And it's no longer mandatory quarantine, it is protective and safe quarantine, whereby we have now psychosocial people, we have psychologists, we have people to talk to them so that you don't feel that you are being sent away because you have done something wrong. What we must do and must do again is dispel the fear and the stigma. And this is why what CS has said, you want me to give you doctors who know a lot about case management, tell you about this, about behavior change, about how to dispel fear, how this virus you can actually go through and survive. We have the doctors. But you also need to have somebody who can tell you the danger of this virus if it's not well managed. Why are we having these deaths? And then to even mitigate that death, the ministry is working so hard. And I'm not praising you, CS, because I've been in some of the committees looking for ways of providing oxygen in the whole country. Because oxygen is the best, the #1 line of treating these patients. So we need to make sure every facility that's been designed as an isolation center must have oxygen. So this is already going on, and I know in the next 1 or 2 weeks, most of the facilities will have oxygen. So I know good work is going on, and I think the idea is all of us support each other. You as media, you are doing an excellent job, and I think you will continue to do that. Us now, as professionals, as individuals, as the population, the task is ours, the responsibility is ours. Don't take out your mask. Do not fail to wash your hands. We know that this virus only lasts in the air for a short while. And also if somebody is coughing straight on your face, if you cover yourself, even if somebody coughs when they are there, you will not get the virus. And if you go and touch spaces where somebody has got the virus and you wash your hands, you will not get the virus. So simple things. So don't wait to go and get very complicated drugs and go get into ICU. Keep yourself safe, and we can do this. So CS, I think that is more than enough for now, and I think I'll allow you. And thank you so much for allowing me to do that.
Thank you. Thank you very much, Daktari. And I want just to support what you have said, Daktari. You know, as we speak today, some 634 health workers, health professionals have actually turned positive across the country. It's about 3%. It's about 3% of the cases reported, which is very low, because globally, healthcare workers represent about 10% of the reported cases. And in urging that we continue to protect our healthcare workers, you will recall that yesterday I talked about PPEs. I can confirm here and now that we have sufficient PPEs in this country. If there is a problem, it's probably a problem of management, problem of distribution, but most certainly not a problem of availability. And as you know, we have also allowed that counties can be able to buy and procure their own PPEs with money that we have given them without any reference to the ministry or indeed to KEMSA. We are also asking that professionals, the health professionals themselves, must adhere to what we are saying. And it's great that I'm talking from this institution and from this platform, because we also know that there are some health professionals who are misbehaving. And I can quote 2 cases without naming names because otherwise Dr. Jenga and Daniel Yumbia might take action. We had 1 case of a doctor at Kenyatta National Hospital, a doctor, qualified doctor, who had traveled and instead of quarantining themselves, wanted to proceed on to go to the theater and conduct surgery. Fortunately, they didn't because some nurse reported him. Thank you to the nurse. We also had a case just this week of another doctor who was actually turned positive and wanted to continue behaving normally. Go to a theater and start conducting surgery and you are positive. You know, honestly, this borders on criminal behavior. So we want also to tell the healthcare workers, tafadhalini, whether you are doctors or dentists or pharmacists or whatever, please, tafadhalini, you must follow. You are the first line of defense. And if there is discipline required during times of war, the highest level of discipline is expected from frontline soldiers. And you are the frontline soldiers. If you slack, we can lose this war. So please, I urge you, tafadhalini, tafadhalini. What we are saying is what we must do. If we preach water, let's take water. Let's not preach water and then partake of wine. Asanteni. Any urgent question? Nenda kazi. Okay. Yes. Okay. Yeah. Okay. Okay, let me start with the last one. The issue of circumcision across the country, the season is coming, and we have said very clearly that no such activity is to take place without the necessary protocols being developed, if indeed that will be the case. Because you can now imagine the exposure, to this disease that young men across the country, would face if there was a problem with this matter. So it is an issue we have engaged with the elders from several communities, elders from the communities that we have mentioned, elders from the Kikuyu community, the Kisii community, the Abaluya community. We are continuing to discuss this matter. And the biggest question will be, what is better? Is it better to have a postponed initiation ceremony, and have somebody to initiate or carry out an initiation ceremony and kill our young men. So this is a debate that is going on, but I can tell you that there is nobody at the moment, and it is actually prohibited, to think of such carrying out such activities prior to the agreement with the Ministry of Health and perhaps protocols being developed. We are still talking about it and we are still discussing it. On the matter of the masks and individuals across the country not using masks, my friend, you can take a cow to the river. Unaweza peleka ng'ombe hata mtoni, lakini kama ng'ombe itakunywa maji ama haitakunywa maji, ni ng'ombe tu inajua, wewe huwezi kujua. So, honestly, we must be honest about this. This is the notion that had produced that story I was telling you about yesterday, somewhere in Washington Post, writing that Kenya government is abandoning, its people because of telling people we would like them to wear masks and protect themselves. This is the centerpiece of our defense. Because let me tell you, there is not a single Kenyan who does not know that the defense against the disease is washing your hands, social distancing, sanitizing yourself. All these things, that's the measures that we have given. Every Kenyan knows. If even a little boy and a little girl in the village is singing, I can get it, you can get it. I mean, how much more communication do you think is necessary? But I'm not saying that that we have stopped communicating. We will go the vernacular way. We are very, very happy about some of the activities that we have seen. Even churches going to. There are some people, elders, who have taken road shows and talking about it and telling people with signs. There are some youth groups that are going around houses, especially in densely populated areas, teaching wamama how to wear masks. On our part, we are participating with the Chamber of Commerce, Kenya Chamber of Commerce. We are participating with them to make sure that masks are manufactured by the chamber members at the village level. Going forward, it is not just a question of the big companies. We want also to create business opportunities for tailors. As long as they are following the KEBS rules, we want also our tailors at the village level to start making masks through standard set and through the Kenya National Chamber of Commerce, because these are members of the chamber. And I think that the way to go is to get them being active as well, which hopefully not only creates business in the villages, but also creates masks, for them. And these are free masks that the government is going to pay for through the chamber. So it is not that we are not acting on that. We will continue to try and preach the behavioral change. But behavioral change is not also as something for the government on its own to talk about. It's for all of us. I think the media has been fantastic on this one, on urging behavioral change. And we want the vernacular stations, particularly those vernacular stations of persons who are distant from Nairobi, to really emphasize on the matter that you have raised. It's a very legitimate concern. But let's not mistake knowing what you are supposed to do and refusing to do what you are supposed to do. They are not one and the same thing. Sio unaelewa? Then on the issue of whether we are being overrun in the country, I don't think we are being overrun. Thanks to the work that was done originally, as Dr. Jenga has just said. Thanks to that work, the path of, if you look at the curve, our growth curve, it is a slow gradient, even though it is beginning to curve upwards. If you look at the curve, for example, the Italians experienced when they had their first cases, it was a very sharp curve, way up. And that's why their entire system was completely overrun. At this time, if you compare oranges with oranges, at this time, 140 days or so, from the time we had our first or 10 infections, if you go and Google at this time and ask yourself, what was happening in Italy, what was happening in Spain, their curves went sharply upwards and their entire health system was totally overrun. The reason why we have not been overrun yet, it is not that we are not going to get the cases. The cases will come because they must go up. But they are coming at a pace that our health facilities are able to cope. And that's why, for example, we are next week, we are launching extra facilities for treatment at Kenyatta University Referral and Training Hospital. We have put the 500 beds I spoke about, 60 of which are ICU. ICU is an ICU facility. But remember also that we have had tremendous growth. I tell you, if Kenyans could sing about themselves, for once, they would sing good songs and positive songs. I saw in the media, for example, you know, a video of a Ghanaian facility that Kenyans are passing towards each other perpetually as a great achievement of a 100-bed facility that they put up very quickly. You know, and it's fine. And I congratulate the Ghanaians for putting up that facility. But when we started this journey, we had 8 beds. Next week, Kenyatta University Hospital on its own, in the last 2 weeks, have put up a 500-bed facility, including 60. This is not something that you hear, you know, about in many parts of this continent. That facility will now have almost 1,000 beds. And you're talking about us praising and getting very, very impressed by some other country because they have done a 50-bed facility. I think Kenyans beat themselves up way too much. Appreciate yourselves. You have done a fantastic job. Any county in this country has got a higher capacity that Kenya had at the start of this infectious disease. Any county has got a higher facility, has got a higher capability than the entire country had. And I think that's a story that if you don't want to tell yourselves, at least you should write for our grandchildren. Now, as the issue of quarantine and the facilities of quarantine, I think it is good, it is better for us to be prepared than to be sorry. And that's why we have said that our education institutions, you know, we are converting a lot of our education institutions into either A, quarantine facility, or B, isolation facility. And this is specifically to assist in densely populated areas where the economic status is such that people are unable to quarantine themselves or to be able to isolate themselves. And one other thing about this whole thing about quarantine and isolation, I think in terms of behavioral change, I can report and thank Kenyans because we have seen a fantastic change in the ability to quarantine themselves. People genuinely go and quarantine themselves and behave in such manner because they are now aware. Their awareness level is high. They know they can affect their own families. And we have a lot of Kenyans. We have a lot of Kenyans today who are at home, quarantine or isolating themselves. And I want to thank them. And that behavioral change is saving us a lot of money and is saving a lot of grief because, and you know, Dr. Amos said this yesterday, people who are doing so at home are getting better faster than people who are doing so in hospitals. I think I have basically addressed the issue of the human resource. Yes, again, we continue to upscale and train. And we are training at 2 levels. We are training at the community health worker level because those people who are isolated at home, quarantined at home, can be assisted by our community health workers. And there are many. And every county currently is carrying out the training. The ministry itself has got continuous training for healthcare workers. There we have even got a lot of healthcare volunteers who are also working at the county level and being trained. I think you saw the visit that I did in Nakuru County in one of those facilities that is a training facility for volunteers in the county. So we will continue to upscale the healthcare workers, to train, to protect, to increase the numbers as we are able and as the need arises. Thank you very much. I think, Dr. Jenga, you had one question which you can answer.
Thank you, CS. You've covered most of the questions. My question about, you're from NTV? Yeah, you asked about facilities that are providing family planning to other age. I want to tell you in summary that The council is going to inspect, and we're going to do the needful, but we will not tell you when, because we do this impromptu. Otherwise, if we announce when we are going, we find the place either closed or they have removed everything that will show that they had been giving any form of family planning. So we have our own way, we are on it, and you will get to know once it's done. Thank you.
Asanteni sana. Thank you very much.